Fentanyl, chemical dependency, the opioid epidemic. Amina Elbadri, Business 528, Dr. Jean Gordon at Liberty University. Drug abuse. According to the Centers of Disease Control, there were more than 64,000 Americans who had died from a drug overdose in 2016. Over 2/3 of those deaths were caused by opioids. In the past year, about 236 million opioid prescriptions were written by prescribing doctors. Drug abuse has become so apparent that it is affecting jobs. People have failed drug tests, and the opioid addiction is shrinking the number of job applicants. There are less people applying for jobs due to being unable to go to work because they are addicted to some opioids. Fentanyl. Fentanyl is a potent synthetic opioid receptor. It is mainly used for anesthesia or analgesic for intense chronic pain. There are 3 different ways that fentanyl can be administered. It can be administered orally, through the nose, or through a transdermal patch. There are different doses of the fentanyl patch. There is a 12, 25, 50, 75, and 100 UG. Fentanyl abuse. Here are a few cases regarding fentanyl abuse. In 2016, 900 people in British Columbia, Canada, died due to unintentional drug overdose due to a mixture of drugs such as fentanyl. This case is about a 2-year-old child that was killed by fentanyl transdermal patches. They were accidentally placed on an injury that she occurred during her stay at her grandma's house. She had fallen on the ground, and her grandmother used the transdermal patches as band-aids to stop the bleeding. Later on, the 2-year-old was found dead. The third case was a 59-year-old man who had developed an opioid tolerance due to abusing fentanyl. He used his wife's transmucosal fentanyl nasal spray since October 2015. On May 2016, he was hospitalized due to withdrawal. Now, for your company, there are 3 different ways that I will go over in this PowerPoint regarding different approaches one can use to gain a seller for a drug abuse program. The first is stimulus response approach. It would be a canned presentation where the salesperson will dominate the conversation. The prospect is led into answering questions, usually agreeing with the salesperson. The salesperson goes into the conversation with a set script. There's not much involvement with the prospect. Concerns or issues of the prospect will not be addressed. An example of a stimulus response approach would be regarding drug abuse programs or chemical dependency programs. In 2016, more than 64,000 Americans died from drug overdose. Do you know or have anyone in your company who has suffered from a drug overdose? This question will lead the consumer into answering, leading on to more information to another question. Well, did you know fentanyl can be administered in 3 ways? Have you heard of the 3 ways? If not, let me explain. And I can also go in detail regarding how detrimental misuse of fentanyl can be. Third, drug abuse has been so apparent. Many job applicants are failing drug tests as well as having less able bodies at work. Have you administered drug tests at your company before? Has anyone failed a drug test? These questions lead the consumer in responding, allowing the seller to reel them in without getting to the bottom of why the consumer really needs the program. The next is the selling formula. It's a step-by-step process that involves customer involvement. It matches the product to the customer's needs. Conversation about the product. Basically, get the customer to talk about the product themselves, throwing out facts and information, allowing them to have awareness. They're interested, desire, and action. So basically, with the selling formula, you talk about the product and you also talk about the company and you have the consumer talk about the company. So, first, since your company is so large, there are many employees who suffer from a chemical dependency. This could in turn cause many to forcefully resign due to a failed drug test. Then, the consumer will begin to talk about the employees as well as drug tests. The reason there is shrinkage of job applications could be due to a drug problem that causes those who could be working to stay unemployed. This could start a conversation regarding job applications. The company could start talking about themselves and realize that they actually have not been getting as many applications in the recent years. Another one. In 2016, Congress spent $1 billion to combat the opioid epidemic, but it will take more than just money from Congress to assist with it. This will get the company to start talking about what they can do with their employees to help with chemical dependency. Lastly, the seller could come in with that being said, it is important to implement a chemical dependency assistant program within your company. The last selling method could be the needs satisfaction method. This is the most marketing oriented. Customer oriented selling. It helps the customer meet their needs while making purchases they feel satisfied with. This is done in 3 stages. The first stage is needs development. You help the consumer identify the problem that they're really trying to solve. Chemical dependency within the company. Needs awareness. Ensure the consumers recognize the same problem the salesperson sees. We need to be on the same page. Needs fulfillment. Highlight solutions that are available to assist in resolving the consumer's problem. Next, I have created a diagram to show you stage 1, stage 2, and stage 3. Stage 1. This is where you get the customer or consumer to see what they actually need solved. What stressors within your company that could potentially drive an employee to depend on medication? Are there any employees currently dealing with drug addiction or failed drug test? And what happens when an employee fails a drug test? This allows the employer to think about the problems within the company and how they can solve it using a drug abuse program. Second, needs awareness. This allows the company to really see the issue and allows the seller to be on the same page. It appears that during this time of year, it could be Christmas, it could be summer, or it could be fall, your employees are overly stressed. This allows the employer to see where their employees could be stressed out. Another example could be over 15 of your employees were hurt on site and now require medication for chronic pain. This could lead to an opioid epidemic between those 15 employees. There should be a drug abuse program there. There are employees that suffer from drug abuse but don't know where they can seek help. Employers can open their eyes and see that they do need drug abuse programs. Last stage, needs fulfillment. There can be a program that can help employees with their chemical dependency. Better assistance for those who fail drug tests rather than firing employees. You can help create programs for them. References. There are 5.